Hi, I'm Dr. Abhida Shah. I'm a consultant neurosurgeon at the Apollo Hospitals, Navi Mumbai. So today I'm going to be talking about epilepsy. Now, epilepsy is a little disabling condition. It's not a malignancy or anything, but it makes you disabled because you don't know when you're going to get a convulsion. You have to take drugs for it for your whole life to control the disease, and it makes you a little socially impaired, because you're worried that in a social condition, if there is some stress or if there is some issue and you get a convulsion, who will look after? So most of these diseases that cause epilepsy, most of the brain problems that cause epilepsy are treatable by drugs, and you get a fairly good control with drugs. But there are some issues that are surgical epilepsy. There are some conditions, the brain, one of them is a mesial temporal sclerosis. If you have this condition and if you need 2-3 drugs to control your convulsions, then you should go ahead with a surgery for this, which I'm able to do very beautifully and preserving all the normal structures. And if you have this condition, it is a completely treatable condition. The dependability on the drugs decreases. It might come down to one drug or maybe sometimes no drugs at all, and you can have the potential of being a normal person again and having a normal life. So this is something that is very potentially treatable. So if you have convulsions and if you fit into this diagnosis of mesial temporal sclerosis, you have an option of surgery. Thank you.